Non-permanent healthcare staff at the George Mukhari Academic Hospital haven't yet received their salaries.
Well, Union Denosa has confirmed this, and our reporter Khayelihle Khumalo is on the ground to find out whether the issue of non-payment is widespread and what's being done to rectify this. Khay, a very warm good morning to you. I mean, this is quite devastating. It's not the first time we've heard from Denosa or any of their members being affected by non-payment, but just give us context as to why we're still having this conversation.
Well, undoubtedly, it is a main concern for the workers, especially in the midst of the pandemic. You know, the healthcare workers have been a very main force in terms of tackling this particular pandemic. But we do understand that it's an issue regarding the human resource management. But Denosa does join us now, really, just to give us a further elaboration. So, Mr. Gado, obviously we're facing this particular problem. What's really behind this issue?
Well, on our initial visit here, when we engaged with management, what we appreciated is that they were honest with us and they expressed their frustration as well from the nursing admin that we met, the nursing management. They expressed their own, frustration that they've submitted, they've done all the necessary paperwork to submit, the papers of these nurses who have been contracted. And now the challenge that is there, it's a challenge that remains, of course, with, in our view, the human resource, because they must process everything and ensure that everything is captured into the system, posts are created into the system, so that people can get their money. I mean, they must also put themselves in these nurses' shoes. They would understand that when you wake up and go to work, you expect that you would get remunerated. In fact, it borders on unfair labor practice. People have rendered a service, but they've not been paid. Their families are hungry. As well, you understand that during these COVID-19 times, you need money to buy, protective clothing for yourself, to buy a mask, sanitizers, and also being a healthcare worker, when you get home, you don't just walk into the house. You have to go somewhere and strip and make sure that you go straight to the bath. All those processes require funds. You need to, eat because you cannot work on an empty stomach. So really, these nurses are frustrated by the situation that they find themselves in.
Okay. And do you know the number of the workers that are affected? Obviously, a very great deal of inconvenience for them.
Well, our engagement was that the number we're given was around 46. And when we further interacted, we were told that 18 of them, the run had gone through on Monday. So our expectation that if indeed that is true, many of them should be able to get their payments this week. And but for us, this should not wait for a run for the remainder. So that is why we'll appeal to eGov and also to the DTG of HR at the provincial department, because in engaging the MEC acknowledged and he promised that this will be sorted out. So it's not a matter that should wait for the normal runs. They should create a special run so that these nurses are paid as in yesterday. So the total number we had was 46, and out of that 46, that 18 had gone through, and the others, there were still some issues that were missing. So we are also going to be interacting even today with the management to find out what is the issue. Let's push the issue. We'll talk to the HOD as well, and also the DTG of HR to say these nurses deserve to be paid. It can't be. It's been a long time.
All right, sir, before I let you go, do you know if this is widespread, if it's a main concern in Gauteng as opposed to this particular hospital?
Well, yesterday as Denosa, we were at Steve Biko and we checked the same thing. We find that Steve Biko is fine. Tembisa is also fine. So it tells you that if other hospitals can do it right, then it means somewhere, somehow, somebody is incompetent, because you cannot issue letters of appointment to people and then you fail to pay. I mean, it's not been a month, it's been more than a month, and really, where is the problem? So for us, it's an issue of incompetence, because if we were saying the problem is the funds, then it's something else. Here you've got COVID-19, which the government pledged special funds for it. So these posts are funded. It's a matter of getting, how hard can it be to process documents and the money goes into people's bank accounts. So it's really incompetence, and I think that once the issue has been resolved, one issue that as a union are going to push, we are going to demand that those who are responsible for this delay, this inhuman delay, they must face consequence management, because for us, they've not done what they are hired to do.
All right, Mr. Gada, thank you so much indeed. So that's Mr. Gada from Denosa, really talking about the plight of the healthcare workers that haven't been paid. So they will continue to engage with the management to find a permanent solution.
Oh, thank you so much, Khayelihle Khumalo, for giving us that update. I can only imagine, what the frontline healthcare workers are going through at this time, who are directly impacted by these non-payments. It is COVID-19.
It's unacceptable.
It's a need.
It's unacceptable. People need to make ends meet, especially the people who are out there saving lives. They're the last people who should be without their salaries. It's unacceptable.